हसीबा खेलिबा धरबा ध्यानम हसीबा
And because these patients had to find non-pharmacologic ways to treat themselves and to manage their condition, I felt like I had found my niche. And I really loved it, but again, the insurance business kind of reared its ugly head. Used to, in the old days, if someone went into rehab, it was for 30 days. Well, with insurance and this whole idea that someone else has to take care of my health, 4 or 5 days was about all we got. And if you're drinking a fifth of alcohol a day for 4 or 5 years and your nutrition's really poor and you've had a seizure and maybe you're jaundiced, 5 days just isn't quite enough time to turn somebody around. So we kind of had to plant seeds. Keep in mind I work in Indiana, and again in Sanskrit that is India na. So we need to balance the whole person and deal with all areas. And this is a little bit different way to look at the model. Again, the light of the gem, the sattva, or the light of the wisdom that has to illuminate the mind, the mano buddhi, and then all of these things are so important and affect the whole body. For example, the biological intelligence, apar ojas, which is the immunity, the hormones, neurotransmitters, and neuropeptides, the physical body, the indriyas, or the 5 senses. The soul has to illuminate the mind, or real healing will not be possible. All the healing comes from the light.
Do we have some questions? Anyone with questions, please come up.
I'm a psychotherapist in California, and I work with a lot of bipolar clients who use substances to medicate themselves. So could you speak a little bit about that in terms of addiction and how you might work with a bipolar client differently?
na